Hello everyone. Today, we'll be delving into the pharmacist's mandate, exploring its facets in policy, practice, and clinical progress. Our discussion draws insights from key publications, including the KPA Journal from summer 2014 and the Journal of Psychosomatic Research from 2013. We begin by addressing the crucial need to resurrect the voice of our profession. As KPA President Cho Chan-wei wisely states, if experts do not develop themselves, they cannot escape the crisis. We must be armed with the latest academic information. This sentiment is especially pertinent as the KPA Journal made its return in summer 2014 after a significant 17-year hiatus, marking a pivotal moment. The core challenge we face is what we call the crisis of experts in an era where information asymmetry is rapidly collapsing. Our mission, therefore, is clear: to provide nutritious intellectual assets that offer both strategic policy direction and cutting-edge clinical science, ensuring pharmacists remain at the forefront of healthcare. Drawing wisdom from the past, we revisit the 1993 Han-Yak dispute. In an insightful interview, former KPA President Kim Hee-jong issued a significant warning: the threat of corporate pharmacy, reducing pharmacists to mere salarymen. His proposed strategy to counteract this was to secure functional independence before any commercial compromise. He highlighted two key rights that were essential to secure: first, alternative dispensing, and second, ingredient prescribing, which allows for generic substitution. These foundational principles remain highly relevant to our profession today. Moving on to more recent successes, let's look at the policy achievements from 2013 to 2014. In 2015, we saw impressive fee negotiation results, with pharmacy ranking first with a 3.2% increase, followed by clinics at 3.1%, dental at 2.3%, and hospitals at 1.8%. Beyond this, significant progress was made in regulation, including the elimination of the mandatory white coat rule, resolving a 30-year grievance. In billing, we successfully resolved discrepancy investigations, which drastically reduced damages stemming from data errors. And in terms of defense, robust countermeasures were put in place against what's known as pharmarazzi, and against corporate legislation that could undermine our profession. Our mandate extends beyond the counter into public safety and crisis response. A poignant example is our response to the Sewol ferry tragedy. Pharmacists mobilized, setting up a 24-hour volunteer pharmacy at the Jindo Gymnasium and Pangmuk Harbor, with 811 volunteer pharmacists participating and over 223 million Korean won raised to support victims and their families. Furthermore, we've launched significant public health initiatives, including the Headquarters for Proper Drug Use, and in veterinary medicine, we've successfully established pharmacists' rights to supply animal medications, expanding our public health role. Now, let's explore how we are reframing chronic care. The old paradigm viewed conditions like adult diseases as implying inevitable aging, with the primary focus on treatment. However, the new paradigm shifts our understanding to lifestyle diseases, which imply clear causality rooted in factors like diet, exercise, and smoking. This new perspective puts prevention at the forefront. A critical point to remember is the silent killer phenomenon. Conditions such as hypertension and diabetes often present no symptoms until a critical health event occurs, underscoring the importance of early intervention and preventive strategies. A significant challenge in chronic care is the communication gap. Our data shows that 72% of doctors believe they effectively explain treatment goals. However, only 52.3% of patients actually understand those goals. Even more concerning is that only 9.3% of pharmacists actively convey these goals to patients. To bridge this gap, our proposed solution is the implementation of medical collaboration notebooks. These notebooks would allow for the seamless sharing of crucial lab data, such as blood pressure and lipid profiles, across the entire care team, fostering better understanding and coordinated care. We're also advocating for a crucial paradigm shift from compliance to concordance. Compliance implies obedience, a one-sided adherence to instructions. Concordance, on the other hand, signifies a partnership and shared decision-making process between the patient and the healthcare provider. An actionable strategy to achieve this is what we call the leftover meds conversation. Often, patients hide missed doses to avoid feeling scolded. Instead, we can encourage them with a simple script: bring in your leftover medications so we can adjust your prescription and potentially save you money. This approach serves a dual goal: it offers an economic benefit to the patient, and it provides us with honest data on medication adherence, fostering a more trust-based relationship. Let's turn our clinical spotlight to binge eating disorder, or BED. This condition is intrinsically linked to obesity and metabolic deregulation. Current standard treatments typically involve SSRIs, which offer only partial efficacy. Our hypothesis explores the potential of chromium picolinate. This compound is known to improve glucose regulation, suggesting its potential to manage the metabolic craving cycle often seen in BED. This research, sourced from Brownlee et al. In the Journal of Psychosomatic Research in 2013, opens new avenues for therapeutic strategies. The BEACH study was designed to investigate this further. It involved 24 overweight adults diagnosed with binge eating disorder. The intervention spanned 6 months, with subjects divided into 3 groups: a high-dose chromium group receiving 1,000 micrograms per day, a moderate-dose chromium group receiving 600 micrograms per day, and a placebo group. Our primary measures included fasting glucose levels, binge frequency, body weight, and depressive symptoms, allowing us to comprehensively assess the effects of chromium supplementation. Our key findings revealed significant metabolic impacts. Fasting glucose levels were significantly reduced in both chromium groups compared to the placebo. We also observed a clear dose-response effect, with larger reductions seen in the high-dose group receiving 1,000 micrograms. While the behavioral trends were based on pilot data and did not reach statistical significance due to the small sample size of 24, we did observe numerical reductions in binge frequency, weight, and depressive symptoms. These trends, despite the sample size limitation, are promising and warrant further investigation. Understanding the mechanism and clinical application, chromium influences the intricate intersection of blood sugar control and mood regulation by interacting with pathways involving dopamine, insulin, and serotonin. For pharmacists, the clinical takeaway is significant. Chromium presents an excellent augmentation strategy. It's a low-cost option that can effectively support SSRIs in managing BED. The target profile includes BED patients who exhibit pre-diabetic markers or glucose dysregulation. When counseling, it's crucial to discuss both metabolic health alongside behavioral health, providing a holistic approach to patient care. In essence, the role of the holistic pharmacist encompasses 3 core areas. First, we must protect our rights through active policy engagement and collective action within our profession. Second, we need to expand our scope, embracing areas such as lifestyle disease management and fostering concordance in patient care. And finally, we must continuously deepen our knowledge by engaging with emerging clinical research, exemplified by our discussion on chromium. These pillars will ensure our profession remains dynamic and impactful. As we conclude, I'd like to share a powerful quote from Kim-Hee Jong: "The function of the pharmacist will inevitably return to us. Accelerating this is the share of the members." This statement, underscored by the Chinese characters for "Chu Ju Bu Xin," meaning to get rid of the old and establish the new, truly captures the spirit of our 2014 professional update. It's a call to action for all of us to actively participate in shaping the future of our profession.